A very good evening, all. I'm Aditi Lamba. This is Vision of Asia, a daily South Asian news segment coming to you from New York City. Welcome to tonight's episode. You are watching our ongoing report on coronavirus pandemic with latest updates and information. More than 2 million people have been infected globally with at least 130,000 deaths. We again urge all our viewers to continue practicing social distancing and allow time for state and federal governments to concentrate on helping hospitals as well as healthcare workers across the nation and for these medical professionals to be able to take care of the critically ill. According to top infectious doctors today, they said that the United States is not ready yet for reopening, again emphasizing social distancing. We also urge all of you to donate any PPE to your local hospitals, clinics. They are in need of this PPE all across the tri-state. And if you are donating this or food across the state, please connect with us on events at itvgold.com. We want to highlight volunteers and nonprofits during this pandemic who are giving back. Also, reach us if you are on the front line and would like to share your experience with us on our network. We'd also like to send condolences now for the family of Indian American physician assistant Madhvi Aya, who lost her life to COVID-19. 61 years old, she was treating patients with coronavirus when she contracted it while working at her hospital in Brooklyn, New York. She worked in the ER. We send our prayers and condolences again for the family. It's now time to begin tonight's episode with the headlines. Councilmember Daniel Dromm addresses South Asian and Indo-Caribbean communities, Jackson Heights and Elmhurst, New York. Dr. Sahil Chopra on practicing social distancing measures and tips COVID-19, Harvard Medical School. Toyota Hybrid Life hosts exclusive media sessions, Citi Field Stadium, New York City. This and much more right after a short break. Stay with us on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lama and this is Vision of Asia special report on coronavirus impact, measures and updates. Let's begin by taking a look at one of our big stories for the day. Our very recent virtual conversation featuring Council Member Daniel Dromm. He represents the 25th District in New York, Jackson Heights and Elmhurst, home to thousands of South Asians, Indo-Caribbeans and other minorities. Council Member Dromm has also been a progressive leader in Queens for over 20 years. Speaking to us very openly, Council Member applauded all of the frontliners while also reflecting upon racial disparity in his district and the needs of Elmhurst Hospital, which is the epicenter of this coronavirus pandemic here in New York City and is also over capacity. Commenting on federal and state responsibilities, he stressed again the need of PPE and more resources for the immigrant communities and low-income families of the 25th District. Also addressing the South Asian community, Council Member Dromm ensured that his team is there and supports the community and also small businesses and gave his condolences for all that have lost their lives to this pandemic. Here is our interview with Council Member Daniel Dromm.
Council Member, you have openly spoken about the racial disparity, which is being very visible in the communities that we're talking about right now. Could you reflect upon what you meant by these racial disparities and perhaps for our audience to understand the resources that are available for, person in need, undocumented immigrants, or immigrants that come from such low-income families that, they're not able to afford healthcare. Could you please address those racial disparities that you had referred to yourself?
Sure. So as the council member for this district, I have long seen these disparities, but certainly with the onset of COVID, it has been exposed in a way that maybe people didn't notice it before. But those of us who live here do see it. And the disparities are in healthcare, income, housing situations, everything, you name it, you can see those disparities. But for many people in the district, the only way that they can get health care, particularly undocumented, is by going to Elmhurst Hospital. In many ways, Elmhurst Hospital is like a doctor's office to undocumented folks because they cannot afford health care. We see many homes that are overcrowded and illegally converted. So it's not unusual to find a home where you will have 20 or 25 people living in these converted homes under very serious conditions and contributing in many ways to the spread of the virus as well. That's been a big issue for me dealing with the South Asian community in particular. The other one, I think, is the distribution of food and food resources. And, a number of the supermarkets, particularly along Broadway and 74th Street, closed down. One, because I think that many of their workers were getting sick, but also because, the overall situation where people were afraid to come out. So that's really very, very important. And we're working on that food distribution as well. So these are issues that keep coming up. And I think, though, that this has really shown or made us reflect on what do we mean by essential workers, right? The delivery man who brings your takeout order to your home is essential. I would not have food if it were not for that. The people that are on the front lines at Elmhurst Hospital, mostly all immigrants, they are essential workers. The taxi cab drivers, most of them South Asian in my district, who drive cabs for a living, essential workers. We can't get around like we used to be able to get around. So we need to look at what do we mean by essential workers as we move forward. And we're going to find that those are our immigrant workers.
Definitely. And in terms of Elmhurst Hospital, I have to ask you, since we have you here with us, it's made news nationwide. It is so badly hit. Could you perhaps give us a description of what's happening that you've seen on ground, and perhaps the development over the last few weeks, and what you are expecting for this week at least?
Sure. So the situation is bad. Every bed is taken, but they do seem to have a little bit better control over it right now than they did like a week and a half, 2 weeks ago. Elmhurst Hospital was short of PPE equipment, personal protection equipment, such as masks and other types of equipment to prevent them from getting disease, like gowns and things like that. Right. That supply now, I think, is beginning to come in, but here we are, a month into the situation, and they're just getting those supplies. So there's a great need for that. The workers at Elmhurst Hospital are working 12 to 14-hour shifts and sometimes longer. They're so exhausted that they can hardly even get back home and then get back to work again the next day. So we've begun to offer some hospital rooms to them, and that was a struggle for me to get the hospital rooms, not only for the workers that are there, but for those who might go back into overcrowded conditions in the housing where they're living. So there's a provision now where social workers at Elmhurst Hospital will be asking people before they leave the hospital, do you have a place where you can convalesce? Do you have a place where you can socially isolate? Social isolation for many of our folks is not possible. So Elmhurst was dealing with a whole host of issues. The lines outside Elmhurst originally were a block or two long. Now that has calmed down a little bit, and I think we're beginning to get on top of the situation. But it's still very difficult. We've learned of so many deaths. I just heard of the death last week of the president of the Bangladeshi Society, and that was a tragic loss to our community.
And Councilmember, when we're looking at these conditions of the hospital, lack of PPE, and obviously an increase in the number of deaths and the number of cases, what are some of your biggest concerns right now as a council member that's representing this really densely populated district full of immigrants? And what is the need of the hour right now for you and your team?
Well, prior to COVID, the federal government was looking at cutbacks to the health and hospital situation. Now, our immigrant communities depend on Elmhurst Hospital, and Medicaid cuts would really devastate Elmhurst Hospital. I'm hearing something like in the range of about $40 million in terms of cuts to that. In addition to that, New York State, Governor Cuomo asked, because of he's required to give a response to the federal government, about Medicaid cuts as well. We cannot afford any Medicaid or healthcare cuts to our community. This is the epicenter of the virus. If they take away healthcare, this virus will continue to spread, and it will continue to go out throughout the rest of the United States as well. So what happens here is going to affect what happens elsewhere. That's why we need to take care of our immigrant community here.
Council member, since you've spoken about this, in terms of looking at this economic downfall and that the rate of unemployment that we're seeing, your comments on the stimulus package that we are talking about and other benefits that are coming from the federal or state government, how should we be looking at this economy according to you? And how long will it take for us to recover?
Yeah, so one of the original stimulus packages, I'm not sure which one, but it did provide New York City with $1.3 billion in support for COVID-related expenses. Okay, so that will help with face masks, that'll help with gowns, that'll help with hospital expenses, but it did not provide for social service expenses that we're seeing. So as the income goes down, the revenue needs grow, specifically for these social service programs. So we need another package, which Senator Schumer and Senator Gillibrand and the members of the congressional delegation were talking about today, to kind of offset the cuts to the New York City budget. Already the mayor has spoken about cutting the summer youth program. There are going to be other cuts moving forward to other summer programs, what they call the Sonic program, after school programs, and cuts to education, huge cuts to education.
Yes.
We need to make sure that that doesn't happen. And finally, let me say, because I think it's something of major importance to the South Asian community, is we need to support our small businesses.
Yes.
And not just with loans. Loans is one thing, but with grants. And we need to make sure that they get money so they can be made whole again. The immigrant entrepreneurs in our community are what keeps this community together. And so we need to ensure that they are made whole in the end of this process. It should not be going to big banks and corporations. We need small business help, and we need it now.
Now we have a feel-good story during this crisis highlighting some of our key coverages right before this pandemic, featuring Toyota Hybrid's live media session at the Citi Field Stadium, which was held prior to the statewide stay-at-home order. This exclusive VIP event catered to influencers and media to test drive and experience Toyota Hybrid's vehicles, as well as interactive exhibits to showcase innovation. Toyota has been a part of the culture fabric in the US for over 61 years and is committed to sustainable next-generation mobility through their brands. Here are the highlights from this exclusive media session where Annalise McCoy from Toyota showcased the new Highlander Hybrid.
Hi, I'm Annalise McCoy. I am with Toyota. We are at the Hybrid Life event here in New York. I'm going to talk to you a little bit about one of our hybrids. This is the new Highlander Hybrid. It's on an all-new platform, all redesigned, and 17% more fuel efficiency for this year, so we're super excited about it. I'll show you around. So this is our Highlander Platinum model in the hybrid version, and the Platinum is the fully loaded model of the Highlander. So all the bells and whistles, the luxury, everything you could ask for, including this height adjustable power lift gate. So we're going to take a look inside the Highlander now. Captain's chairs are the standard feature in our Platinum on the second row. Very comfortable, roomy. We've also got a third row back here, standard as well. So this is a 7-seater. Super comfy. And I've also got a panoramic moonroof above me too. That's standard in the Platinum. All right, now we're going to go inside the Highlander and see what it's like to be the driver behind the wheel. I'm really excited to show you. A really cool feature about the new Highlander is that we have standard Apple CarPlay, Android Auto, and also Amazon Alexa capabilities. So you're getting all of that connectivity, staying connected as the driver to everything in your life, all aspects, and being able to access it safely, which is great. So one cool new feature of the Highlander is this available 12.3-inch touchscreen for your center console. As you can see, a lot of features available here. We've got our maps up right now. Navigation is standard in your Platinum model. And because this is a hybrid, we have our hybrid system indicator, our kind of energy monitor here, which is really cool. You can go to it anytime, or you can hide it from your view. So basically, you see where the power is going. We've got our engine, our hybrid battery, and what is driving the wheels. So it's a really cool way to kind of gauge your fuel efficiency. You can check out your MPG minute by minute with our hybrid system. You know, the Highlander has always been a great family vehicle. People know it as something that has space, reliability, and lots of capability for wherever you're family adventures take you. But the new Highlander especially gives more quality for family time. So we've got lots of soft touch materials inside, the best in interior seating, lots of comfort. In this Platinum Edition, you even get heated and ventilated front seats. So lots of comfort as you're traveling out there, whether you're vacationing or headed to Target with the family or what have you, the Highlander's ready.
Here we have the brand new Toyota RAV4 Hybrid XSE, as well as the new Highlander 2020. And today we'll be showing them off on this articulating track that we have over here. We'll have hill climbs, we'll go around scenic tours, and as well as a pothole simulation to show how the vehicle articulates over each and every bump, giving you the power and the performance that you need to conquer the winter weather here in New York.
Here we go. We're going to go drive the 2020 Highlander on Camp Toyota course. And brake fairly hard. We'll stop here and then we'll show how this goes through the snow real nicely. See, good traction, even on a slippery surface. And that's the synchronous all-wheel drive with the rear motors. And that completes our lap.
It's time for another short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia Coronavirus Special Report, and I am Aditi Lamba. Today, according to Johns Hopkins University, tally of cases had the United States at more than 600,000 cases and more than 26,000 deaths in the country. Amongst the life lost are also United States healthcare workers who have died after being diagnosed with or showing symptoms of this virus. That includes nurses, it includes doctors and technicians who have lost their lives contracting it while taking care of the patients with COVID-19. So do remember those brave souls and also just our own community and continue practicing social distancing and save lives. Here is our interview with Dr. Sahil Chopra with his expertise in pulmonary, critical care and sleep medicine at the Harvard Medical School. He spoke to us on various factors of the coronavirus, discussing his experience on the front line and also addressing all on building immunity and tips on protecting oneself. Here is Dr. Sahil Chopra's virtual interview.
This brings me to a few more questions that we have from our audience. I think it would be really great if we get some answers for this. This question is, how often do they need to clean their surfaces? So we're talking about, again, in the house where people are staying right now. How often do you think one needs to clean these surfaces? Because we are hearing the virus now stays on the surfaces.
Yeah, so if we look at some data from New England Journal of Medicine, they recently published an article a few weeks ago talking about how long the virus can be found on different surfaces. And what they concluded was that you can find this virus on copper surfaces for up to 4 hours, on plastic for cardboard for up to 24 hours, and plastic and stainless steel for up to 72 hours. Wow. So if we keep that, and then we also have other conflicting data stating that they found the virus in these cruise ships 17 days after when people had abandoned the ship, essentially. So I think this is very debatable. But if we think about this from the concept of being cautious, I think wiping down high-touch surfaces such as phones, keys, doorknobs, at least 2 or 3 times a day is probably a good idea, especially depending on how many people are coming in and out of the home. If you come home once and you're staying home and you've done everything from your end to remain hygienic and using soap and water and wearing masks when you went out, then you probably can wipe it down once. But if you have an individual who is going in and out of the house 2 or 3 times, they had to go to the grocery store, they had to go to the gas station, I think then in those situations, wiping things down more than 2 or 3 times may even be reasonable. So I think it really depends on every individual situation.
And Dr. Chopra, do we need to wear masks and gloves? A very popular question we ask every doctor here. Do you think when we're stepping outside, we're going to the groceries, we're going to pharmacy, or making these runs that everyone has to do normally here, do you recommend that they wear masks and gloves right now?
Yeah, a mask I think is definitely something mandatory. because you don't know if anyone's going to sneeze on you or cough on you, or if there's any aerosolized particles anywhere. The glove, I think, is maybe potentially debatable. It's probably not a bad idea, but you have to realize, just because somebody's wearing gloves, but then you're using those hands that have gloves on them to touch your keys, touch a doorknob, you put those hands in your pocket, then it defeats the whole purpose of having a glove. So having a glove is reasonable if you're not touching your face, you're not touching your eyes, and you're still cleaning all the surfaces that the glove, the, the gloved hand touched. So it's reasonable, but I don't think it's necessarily mandatory.
Mm. Another question that we have here is, what are some of the symptoms to definitely watch out for COVID?
Yeah, no, that's a good question. If you look at the data, symptoms of fever, cough, whether it's dry or productive, and shortness of breath, these are the main symptoms that people usually present with. And I think those are the symptoms that everybody should be concerned about if they are having it. If someone is just having isolated cough, sore throat, or a runny nose, or isolated body aches, I think it's something that you can just keep an eye on.
Right.
But if somebody's having high grade fevers that's not getting better, they're having this worsening cough, they were shorter breath with one flight of stairs yesterday, and now they're shorter breath on walking on a flat surface, these are all symptoms that are pretty concerning.
And like one last question from our audience, definitely we want to know, how often should one wash their hands? Because it's all about washing hands, it's all about maintaining a good hygiene. That's something that we're stressing, but how often do you think we should really, honestly, according to you, wash our hands?
Yeah, again, it depends. If you're staying home all day, once or twice, whatever is your usual habitual routine of washing hands is probably reasonable.
Right.
But it's more important to make sure you wash your hands when you are going in and out of your so-called clean environment. If somebody's going to work and coming back, it's a good idea to wash your hands every time you touch something that you normally do not touch. So at least a few times a day is a good idea. But if you're home, then whatever your habitual routine of washing hands is, that is probably adequate.
In terms of looking at high-risk patients, and there are a lot of South Asian Americans that are at high risk with a lot of chronic lung diseases, heart diseases, cholesterol, blood pressure, diabetes, and also with your expertise in sleep medicine, and as well as the lungs itself, what are some of the concerns when it comes to patients that have these chronic conditions? And also, if they're watching you on ITV Gold, what are certain things you would recommend that they watch out for right now, especially?
Yeah, no, especially if somebody has multiple comorbidities and their age is above 60, 65, it's best that they stay home and give the opportunity to the younger people in the family to help them out or do save up for them or whatever it is that that needs to get done. Specifically, if they have any underlying lung disease, COPD, pulmonary fibrosis, asthma, if they have any congestive heart failure, if they've had stents put into their heart, if they have diabetes, if they have high cholesterol, if they've had strokes in the past. These are all, if they have chronic kidney disease, these are all individuals that if they do end up getting sick, the chances of recovery are lower as well as the chance of them getting sicker is higher. So it's best for these individuals really to just stay home. If they don't have an option and they have to leave their home, definitely wear a mask and wash your hands every time you touch something that you don't routinely touch.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for tuning in tonight. This is Vision of Asia. I am Aditi Lamba. Take care, be well, and stay safe.